Did you know that nearly half of all women will experience vaginal dryness at some point in their life? But this is rarely talked about. In this video today, I'm going to be telling you some of the causes of vaginal dryness and what you can do about it. Hi guys, welcome back to my YouTube channel. If it's your first time here, my name is Melody and I'm a registered nurse. Make sure you watch this video to the end. There's loads of things to learn from it. Vaginal dryness can be uncomfortable, and knowing the causes is the first step in finding a solution to it. Now, when it comes to vaginal dryness, some women complain that their vagina is dry throughout the day and they don't have any kind of discharge at all. But some other women complain when they have vaginal dryness during sexual intercourse. Ideally, when someone is trying to have sex or when someone is aroused, the vagina is supposed to be wet to allow for easy passage of the penis. But if this is not happening, there are some causes. And the first one I'm going to mention is hormonal changes. So hormonal changes can happen during menopause. It can happen when a woman is breastfeeding, when she's pregnant, or even some hormonal contraceptives that women take can also cause vaginal dryness. So for menopause, when a woman reaches menopause, the hormone estrogen will drastically drop. So estrogen is what helps to keep the vagina lubricated and elastic. So when a woman reaches menopause, the level of estrogen will drastically drop and then they experience vaginal dryness. Estrogen level is also low during breastfeeding, which will also cause vaginal dryness. Stay on hormonal changes. If you're on any contraceptive, whether it is an IUD, the implant, or the pills that contains hormones, this can also disrupt the estrogen level in your body, which can also cause vaginal dryness. Some of these hormonal medications, they give you a controlled level of estrogen and they are also synthetic. Your body doesn't respond to them as much as it will be if you are producing a natural estrogen. So that vaginal dryness is usually a side effect of hormonal contraceptive. So if you're a menopausal woman and you are experiencing vaginal dryness, one thing you can do is to get a lubricant. There are different types of lubricants that are available to buy from a pharmacy. You can buy which of them is suitable for you. Also, there are hormone replacement therapy that your doctor can prescribe for you. So if this is something that is giving you concern, you should definitely speak to your healthcare provider. You shouldn't deal with it on your own. You shouldn't accept it as a woman, because menopause is something that happens sometimes 45 years, 40 years, 50 years, and a woman is already in menopause, and that is still very young for you to like forget about your sexual experience. So if this is a concern, definitely see a doctor. Hormonal replacements are very, very effective in controlling some of these symptoms that comes with menopause. Same thing applies for breastfeeding moms. If you are breastfeeding and you are experiencing vaginal dryness, there are also lubricants that you can buy. And for hormonal contraceptive, if you think that it is giving you a concern, you should definitely speak to your healthcare provider. There are different methods of family planning. If anyone doesn't suit you or if it is giving you a problem, you should have that discussion with them and have plans. Is this something you can manage? Do you want to try another method of contraceptive? There are different methods of contraceptive. You shouldn't have to stick to one that is not working for you. The truth is, the first reason why you're even getting a family planning in the first place is for you to have a good sexual experience without thinking about pregnancy, isn't it? But if you're now in that position where the family planning is now preventing you from having that sex, why did you even get it? So if you have a family planning method that is not working for you, you should go back to your healthcare provider to seek for another alternative. I did detailed video on different problems that women encounter that can cause that can cause pain during sex, and vaginal dryness is one of them. So please go and look at that video as well. Another thing that causes vaginal dryness is medication. So we have medications like antidepressant, antihistamine, some types of blood pressure medications. They also cause vaginal dryness. For antihistamine, they have that drying effect on every part of the body or the mucous membrane. If you take any antihistamine like Piriton, for example, when you wake up in the morning, you feel that dryness in your nose. That is the same effect it has. So if you're someone that is on regular antihistamine for maybe some form of allergy, you might notice a kind of vaginal dryness. And this is something you can discuss with your healthcare provider as well. If your antidepressant or your blood pressure tablet is also causing you vaginal dryness, You should also speak to your doctor. There are different alternatives to medications actually. Sometimes medication, there is another one that you can try. So, but if you don't go, you won't even know. So if this is something that is bothering you, go to doctor. They can always change your medications for you depending on what kind of medication we are talking about. Another major reason why some women will have vaginal dryness is that they are not properly aroused. So during sexual intercourse, ideally there is increased blood flow to the pelvic region. So this increased blood flow is how the fluid will seep out into the vagina and cause wetness to happen. But if a woman is not properly aroused, she's not interested in the sex, she's stressed, this process will not happen. So the vagina is dry. To avoid this, you should be properly aroused before penetration. Make sure you and your partner understand how your body works. All of us, we have different ways our bodies work. This is going to be helpful for a woman who is struggling with vaginal dryness. Another factor that people usually ignore when they talk about vaginal dryness is dehydration. Dehydration means your body doesn't have enough fluid. So this can be because you're not drinking enough or the weather where you are is very hot. So anything that is making your body not to have enough fluid, or even certain conditions like diabetes, you can be dehydrated sometimes. So if you don't have enough fluid in your body, mucous membranes in your body, including the vagina, is going to be dry. So that fluid that is coming out from the vagina, it is part of the fluid from inside your body. So if this is not present, you might experience vaginal dryness. And it's not just about knowing when to drink more or not. It's also understanding that things like alcohol, caffeine, they also cause dehydration. So you need to understand how these things work and how your body manages fluid so that you're able to be on top of the game. So yeah, dehydration is a big factor in vaginal dryness. And finally, other health conditions like diabetes that I mentioned, autoimmune diseases, so many factors can cause vaginal dryness. So the important thing is to understand what could be causing your vaginal dryness. If you don't understand why you're having vaginal dryness, especially if it is something that hasn't always been there, you are not menopausal, you should definitely see a healthcare practitioner for this. And sometimes women who don't usually want to talk about these things because we are shy, we just feel like somehow somebody is going to judge us. But in the end of it, what it means is that I can be going through the same thing. The next person is going through the same thing and nobody is talking about it and nobody is getting help. So who does it even help? So if you have any concern like this that is affecting your sexual health, you should definitely see a healthcare practitioner for that. And sometimes you feel like, is this even enough? It's like, it's not killing me, so why should I see a healthcare professional? But that is not true. It is also important that every one of us would understand how our bodies work. When it comes to sex, things would always work differently for different women. So understanding how your body works and communicating how your body works is also important for you to have a better experience. Thank you guys for watching my video. Please make sure you subscribe to this channel. It is very important. It helps to support the channel. Thank you guys for watching. Bye bye.